వినిపిస్తుందండి వాయిస్?
Hi, this is Dr. Vinata Puli. I am the Clinical Director for Obstetrics and Gynaecology at Cuddles, Kondapur. Today is an important day. 28th of May is celebrated as International Day of Action for Women's Health. Let us know a little more detail about this day, importance of this day, and what are our thoughts and views that we can learn from this day. And let us see in 2022 what is our goals and aims, and this is a time for us to celebrate and also do something towards women's health. So next slide please. So importance of the day. So in the year 1987 itself, May 28th has been declared as an International Day of Action for Women's Health. There was two separate global networks that were happening at the same time. One is Latin American and Caribbean, and another one is Women's Global Network. Both are working towards the same rights of women, and they both combined, joined hands together, and then decided this date to celebrate and mark a day or a moment to work towards the common goals of implementing all women's rights. So that is the reason why this day has been chosen. And from almost 35 years, 1987 onwards, this day has been celebrated as the day, International Day of Action for Women's Rights. It also creates a platform in the world to remind everyone of this unique speciality, so the governments and everyone will also come towards working towards the goal to preserve women's rights. Next slide please. So in every year, they come up with what is their main goal or motto for that year that they have to work towards. And in year 22 also, they have a few things that they want to remark or goal that they can work towards it. And this year calls for three different goals. One is resist and persist. I'll explain why they have chosen this. And women's health matters, and SRHR is essential. What is SRHR? It is sexual reproductive health and rights of women, and that preservation is essential. That were the goals in the previous years, SRHR and women health matters, but they continue to do because till that implementation happens, that is there. And especially resist and persist is chosen as the main goal of this year. Next slide please. So COVID has come and made a great impact, and that has in a way created so much of hurdles for women's care and rights, and that is the reason why this year they chose resist and persist as the main goal or theme. And next slide please. So what does this involve? Resist and persist, especially post pandemic, there has been a lot of impact that led to loss of livelihood of women all over the world, and men and women. This is loss of livelihood happened to many. Especially this has made our way more difficult, and this has increased the unpaid care burdens on women and girls. And also, this has heightened to the gender-based violence and barriers to accessing essential healthcare services, especially for sexual and reproductive health services. And this has led to many unsafe abortions because there was no access to healthcare, and post-abortal care hampered. And these were the reasons why this year resist and persisting with our preservation of rights has been chosen as a main goal for 2022. The next slide, please. The next one is SRHR. What is sexual reproductive health and rights? So what are these rights? Let us see what these rights are. So the main rights, like, right to choose a partner for themselves, right for the women to decide when she wants to have sexual intercourse, right for the women to decide on when she wants to have a pregnancy, and right to decide if she doesn't want to continue the pregnancy, right to choose a good contraceptive method of her choice. And all this, it is essential for us also to provide that information so she can avail this right in a very informed way. Next slide, please. So, for our last today, what I thought is to discuss about this day and everything. I will also concentrate on discussion of a few topics to preserve the rights of these women. The main topics that I want to put on today is what are the choices that girl or woman has regarding her contraception, so she can have an informed choice. What are the things that she can do to avoid or to reduce her risk of sexually transmitted infections? And let us see one after the other. First thing is contraception. So, what is contraception? Next slide, please. So there are so many methods in which we can avoid an unwanted pregnancy. It is different when you are planning a pregnancy, that's different. But when you don't want a pregnancy, what are the things that you can do? What are the methods a woman has to choose from? So the first one is natural method. Means there are no hormones involved, there are no medicines involved, there are no injections involved in this. What a woman can do. So one first thing is abstinence, means if you don't have sexual intercourse, then obviously there's no pregnancy. That is called abstinence. The next common method that many people use, though it is not a very reliable method of contraception, is rhythm method. Means they watch the menstrual cycle and they avoid having sexual intercourse when there is a time of ovulation. Means when it is a fertile time, that there is a very high chance of women getting pregnant, they avoid having sexual intercourse in that time, the ovulation time. How do they calculate? How do women calculate when is their ovulation time? It can be very varied. Many women will have regular menstrual periods. That means around 28 to 31 to 32 days is the normal routine pattern for menstrual cycles. For many women, this will happen. Obviously, this method will not be applicable for those women who have irregular periods. But for those who have regular periods, they can either watch body temperature that can raise just before the ovulation, or they can watch the consistency of the mucus, cervical mucus secretion that some people can observe, but when there is some infection or fungal infection that will destroy the natural physiological process and they cannot determine, and also observe the fertile time. So when you have 28-day cycle, you can roughly calculate when is the ovulation time. Around when you start counting from the first day of the period, 10th day to 17th day will form the very fertile period. So if you avoid sexual intercourse in that time, there is likely chance that there will not be any pregnancy. But if the ovulation happens before or a little later, we will not be able to. That is why this is not a very reliable form of contraception. So that because it amounts for failure rate because of our problem in estimating the ovulation the right way. Next slide, please. So what are the other methods that are available to choose from? So women have wide varied choices. One is pills, one is implants or injections, and IUCDs or intrauterine devices or implants. So what is a contraceptive pill? It's a tablet. Women can take every day of the whole cycle, 21-day cycle. Period, and sometimes in the pack there will be other 8 also that corresponds to complete cycle. So every day she has to remember and take a pill, but this has to be prescribed by a doctor to start with, because there are some instances or incidences where we cannot give the pill if there are contraindications. So we have to see the criteria and make sure that is safe and it is fine for the woman or girl to use that contraceptive pill. Once it is prescribed, it is in her control, like whether how to use the pill. The only drawback is she has to remember and take the pill every day in a similar time. If she misses a period, then obviously there will be a failure rate. But if used correctly, ideally, this is a very good contraceptive with a failure of less than 0.1%. But in day-to-day practice, we see many failure rates because most of the time it's very difficult for people to remember and take it in the right time and right duration. So that's the cause of failure. So what can we do to try and improve, or are there methods that you don't have to rely on remembering and taking the pill? Then came the implants and IUCDs. What is intrauterine contraceptive device is we put a coil, which we call it as either copper T or a hormone containing coil, into the uterus. It stays in the uterus and it's very long term, like it can stay for 3 years or 5 years, and it stops pregnancy to form. And that takes off that disadvantage that you cannot remember to take a pill. Here you don't have to remember, but at least you have to remember to check once in a while and to come after 3 years or 5 years when it is due for removal. And what are implants or injections? The same hormones, instead of taking as a tablets, we can also give in the form of injections and implants. Injections are higher dose hormones. They can be given once in 3 months, but it has to be every 3 months. Implant, also, once you insert the implant in the arm, it will stay for 3 years. Somehow this is not widely available in India, but in Western, it's a widely accepted method of contraception. The only drawback for this is it can cause unscheduled irregular bleeding because of the hormone. But if it's a very reliable form of contraception, so once in 3 years they just have to remember, and like an injection they get it done and remove and put another one if they are happy, or if they want to continue the contraception. And if they don't want to continue the contraception, if they want to plan the pregnancy, you just have to make an appointment to remove that implant or stop the injections, and in few months you can try for pregnancy. So these are effective forms of long-term contraception, implants and IUCDs. So next slide, please. Are there other forms or contraception? There are barrier methods, that is condoms. Many people are aware of male condoms. You can see in the slide at the farmost end is a male condom, but the second one that you can see is a female condom. It is, you can order online, you can there's a greatest advantage for barrier method is, yes, it's a contraceptive, but also gives a protection for sexually transmitted infections. So for your health reasons, till you are planning pregnancy, we always advise use a barrier contraceptive, and you don't have to rely on a male partner to have that control and use it. You don't have to request them to use it. If you have a female condom, then the control and the empowerment is on you. So you can prevent sexually transmitted infections, and you can have the control to have the contraception also. So initially you might have a little difficulty how to insert the condom. With one or twice of usage, it becomes easier, and the doctors can also teach you how to use the condom. Once or twice if you use, later it becomes a routine and it's comfortable to use. It is not a difficult process to learn. It is a very easy process to learn. And the other method of a barrier, which used to be there more frequently, was a diaphragm. The extreme in the right side, you can see the picture of a diaphragm. It's like it covers the cervix. The uterus is the womb, and under that, the mouth of the uterus is called cervix. From the vagina, the sperm has to enter the vagina and go into the uterus. And this diaphragm covers that area. It still lets you to have the sexual intercourse without problem, but it covers the cervix so sperm doesn't enter. If you have female condoms, then it has both advantages. It covers and also enables sexual intercourse fine. But because it is not used every time at the time of sexual intercourse, and sometimes there can be breakages, the failure rate of this form of contraception can vary between 10 to 14%. That's why it is also not considered as a very reliable contraceptive, but it's very good in preventing sexually transmitted infections. So this has got the extra advantage of not just contraception, but also for health reasons to prevent infections. Next slide, please. So there are other permanent methods, all surgical methods of contraception, which is vasectomy for men and tubectomy for women. Vasectomy is from testis, sperm will travel into the penis with the tubes called vas deferens. So that can be tied, and that will result in permanent sterilization for men. But you have to wait till there's no sperm and make sure that it is then effective. The failure rate is very, very less. Like if we do the procedure and having a pregnancy after that procedure is very rare with permanent forms of contraception. Especially after vasectomy, the failure rate is almost 1 in 2000. Like if you have to do thousands and only one will fail. But whereas for women, it is also effective form of contraception. Later, you don't need follow-ups. Like it's long term and no follow-up is being required. But the failure rate is 1 in 200. If we do 200 procedures of tubectomy, one can come back with a failure. So compared to implants and IUCDs, they are also effective long-term health options for contraception. But those who don't want to go for surgery, we can choose from implants or intrauterine contraceptive devices. But if you are having surgery for other reason, then you can opt for permanent forms of sterilization. They are permanent for all practical purposes. If very rarely, if you want to reverse, yes, we will do it with the chance of 40 to 50%. But for all practical reasons, without surgery, they are considered permanent. So next slide, please. So the different topic, like once you are using contraception and if that fails, then we also need a very safe abortion laws, and that is to protect women's health. Because in the WHO report, it's almost like so many millions, 73 million abortions are happening in a year worldwide. But it is very sad to see almost half of them are not done in a very safe places. So there are unsafe abortions happening worldwide that will put risk for women's health. So we have to aim and try to reduce this unsafe abortions. And next slide, please. And most of the unsafe abortions are happening in developing world, and where the abortion laws are not at very ease. So WHO came up with this very good planning to prevent unsafe abortions, is to have a comprehensive sexual education. So many people will use contraceptives, so you end up less going for unsafe abortions. Access to the contraceptive options that should be affordable and accessible. See, in COVID time, there was so much of limitations for access of these contraceptions, and that is when unsafe abortions have increased. And provide that care to help women to have a safe abortion if they want to proceed with abortion. And it has to be provided by a trained personnel. So we need to have more trained personnel to give the tablets or to do the surgical procedures, and that has also to be in affordable places. And all governments also should have the responsibility of providing this in an affordable ways. Next slide, please. And this is the COVID time. We have lots of challenges. There were no outreach services that were available. Information that was provided was misleading. We were ill prepared and with the facilities and equipment, and there were issues related to the supplies, and this has increased the unsafe abortions to a large extent. And this year, we have to make sure that goal of creating that environment for safe abortions have to come up. And next slide, please. So this is to improve the access to safe abortions. So there are multiple roles. It's individual. People have to take up a lot on their own self-education. So they use effective forms of contraception, so you won't end up in unwanted pregnancies. And the governments also should take up that provision of supplies to make sure that supplies are adequate, to make sure that facilities are there, and you create that environment where you feel that you are safe. So women who approach that government facility for an abortion should feel safe to come and get it done. Next slide, please. And unintended pregnancies can be prevented by a comprehensive sex education for both boys and girls. Start early. People are starting sexual intercourse very early on in their lives than what is thought or anticipated. So start the education also early, so we don't end up having too many teenage pregnancies and thereby increasing their chance for unsafe abortions and spoiling their health. Next slide, please. So controlling the spread of sexually transmitted infections is also in our goal and agenda for this year. And the next slide, please. So how do we reduce the sexually transmitted infections? So we educate girls and boys to limit the number of sexual partners the individual has, and don't tell them not to have unprotected sexual intercourse, and making sure that if they have to have a sexual intercourse, it has to be protected. Use a condom or a female condom when you have sexual intercourse. And if any, by chance, if there is unprotected sexual intercourse, that has to be like you can go and get tested whether you contracted any sexual infection, and early testing, detection and treatment at least will prevent long-term health problems secondary to those sexually transmitted infections. And raising awareness is our job. It is one of the things that we are also doing as social activists, doctors, nurses, teachers, everyone around the world are contributing to the educational programs to raise the awareness among boys, girls, and women to preserve that the right for safety when you have sexually transmitted infections, and you should know how to prevent them. Next slide, please. Thank you. So hopefully few goals we have discussed today has raised that awareness, and so you know what are the contraceptive options, you know how to reduce the sexually transmitted infections, and if at all there is an unintended pregnancies, how to have a safe abortion and post-abortal care. Thereby we can have some protection of women's right towards their sexual and reproductive health. Thank you. And I am open to now to take the questions regarding this. Any questions? So if no one has questions, maybe we can stop this show.